Pelvic pain is usually one of the most common reasons why women come in for a pelvic ultrasound scan. Pain will be mild, to be moderate. It could be a dull pain, a sharp pain, maybe a severe pain. But the important question is, what exactly are we looking out for when you come in for a pelvic ultrasound scan? Today, I'm going to walk through some of the medical reasons behind pelvic pain and why ultrasound is usually the investigation of choice. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. What is pelvic pain? Pelvic pain is basically any pain in your lower abdomen that is below your belly button, and ultrasound is useful in visualizing organs of the pelvic region, the uterus, the ovaries, and surrounding structures. As a sonographer, these are the most common things we assess when patients come in for a pelvic scan. The first is ovarian cyst. The pain could be mild, with experience pain during ovulation, the experience pain during sexual intercourse. And on ultrasound, we check for the presence of a cyst, we check for the size of the cyst, we check for the number of the cyst. It could be multiple. We also check if there are complications like ovarian torsion or rupture. The next reason for a pelvic pain could be an ectopic pregnancy. In this case, there's usually a positive pregnancy test. There could be slight spotting or bleeding. The pain is usually severe. And if all these are present, it is an indication to rule out ectopic pregnancy. The third reason is fibroids. Fibroids can cause heavy menstrual bleeding, pelvic pressure, painful urination, and even painful periods. And ultrasound helps to determine the presence of fibroids, the number, the size, and the location. The fourth reason is PID, pelvic inflammatory disease. PID can cause fever, vaginal discharge, lower abdominal tenderness. And on ultrasound, it presents as fluid in the pouch of Douglas. There could also be probe tenderness. That is when your sonographer applies pressure, you feel pain. And then in severe cases, there could be an inflamed tube or abscess. The fifth reason is endometriosis. If you have a painful menstruation that is beyond your normal menstrual cramp, it's an indication to look out for endometriosis. On ultrasound, it presents as a chocolate cyst or what we call endometrioma. The sixth reason is ovarian torsion. This is sudden, severe, one-sided pain, often associated with nausea and vomiting. It happens when the ovary twists around itself, usually if there are multiple cysts or a large cyst. And Doppler examination is important in this case to check for blood flow, and it requires urgent medical intervention. The seventh reason is adenomyosis. With adenomyosis, you could have heavy and painful menses. And on ultrasound, we usually see a bulky uterus that is heterogeneous. What I mean by heterogeneous is the appearance of the uterus will not be uniform. The next reason is unexplained infertility. Usually ultrasound is done on women. Pelvic ultrasound is done on women who are trying to conceive. And then we are looking out for the follicles in the ovaries. We're looking out for the uterus appearance and the endometrial cavity appearance. Another reason is post-procedure or post-surgical pain. Pelvic pain after a procedure or after a surgery can be a clinical indication to do a pelvic ultrasound scan. For example, after a D&C, after a cesarean section, after a fibroid removal, or any other gynecological procedures. Ultrasound helps to check for fluid collection, the retained product of conception, inflammation, and the presence of an infection. This helps or this guides further medical management or intervention. Why is ultrasound usually the first investigation of choice? Usually ultrasound is the first investigation of choice because it is safe, it doesn't make use of radiation, it is affordable, the results are easier and quicker to get, and the waiting time is low. Pelvic pain should never be ignored, especially if it is severe, persistent, and something unusual to you. A scan can provide answers, reassurances, and early diagnosis. Ultrasound is safe, accessible, and gives you an immediate insight on what is happening within your pelvic region. Early diagnosis can prevent complications and enable the right medical intervention. In subsequent videos, I'm going to be making a more detailed explanation on some of these medical reasons behind pelvic pain, especially ovarian cyst and uterine fibroid. If you have any more questions, feel free to drop it in the comment section and I might just make a video on it. If you have any experience you would like to share, feel free to drop it in the comment section as well. If you found this video helpful, don't forget to like, share, and subscribe. And I'll see you in my next video. Bye bye.